Many people mistakenly think that they must start Medicare at 65, and if they don't, there will be problems and lifetime penalties. Now, it is true that some people must start Medicare at 65, but it's equally true that many do not have to. In this video, I'm going to show you why 50% of all seniors today are refusing Medicare A and B at 65, and in doing so, they are not making a mistake. All right, I want to begin by just briefly making sure everyone knows the people that have to start Medicare at 65. In other words, they're required to start at age 65. Okay, there's 5 groups of people. Number 1, anyone who is no longer working. Okay, this means you're no longer working, your spouse is no longer working, we do not have an employer plan that's available to us at all. Okay, so we got to go on Medicare at 65. Second group of people would be anyone that's on COBRA insurance. COBRA insurance. Now, the reason for this is because, by the way, COBRA's fine for a limited period of time, but COBRA insurance, once we're Medicare eligible, moves to the second payer position. And so if you're turning 65 and you're 65 and beyond, and you only have COBRA, then what happens? You become the first payer because, again, COBRA is only going to pay second. So you're required to go on Medicare when you turn 65 if you're no longer working and covered by COBRA. The third group of people would be anyone that's on what's called TRICARE insurance. TRICARE is for those that are retired from the military, and it's just like COBRA. TRICARE, once you're Medicare eligible, will only pay second. If you don't enroll, you pay first. And the next group of people would be anyone that is covered by an Affordable Care Act plan, the healthcare exchange. So you went through the exchange to get either an individual plan or a family plan. But if you're approaching 65, here's what happens. All the incentives with the ACA plan, reduced premiums, tax consequences, tax subsidies, cost sharing. In other words, all the benefits that make an ACA plan look good to you financially are going to go away at 65. So technically, you can keep an ACA plan, but there's no reason to do so. You'll pay full premium, you'll pay full deductible, there's no cost sharing help for the government, so you'll have to meet the max out of pocket as well. So again, you're not going to keep an ACA plan, you're starting Medicare at 65. And then lastly, anyone that is still working or their spouse is, but you are covered by what Medicare calls a small employer. Small employer, and this is defined by there's 19 or less people on the payroll. Not covered by the plan, it's on the payroll. So 19 or less, you have to go on Medicare because Medicare takes the first payer position for small employers, and then your group plan, if you keep it, is going to be second to Medicare. So again, if you don't enroll, you have a large claim, that insurance company can say, hey, you should have taken Medicare, you're a small group, we pay second, you pay first. All right, so that's the 5 groups of people that must go on Medicare at 65. Now let's talk about those who can refuse. Now you're going to notice there's only one, and you probably picked up on this already. So only one group of people do not have to go on Medicare at 65, and that is people that are still working, and they plan to keep working, and they're covered by a large employer plan based upon Medicare standards. And what is that? That is 20 employees on the payroll or more, okay? And so these must, but these do not have to, and it's fine for you to refuse. So next, I want to talk about the options that are available to those of you that you or your spouse are still working and you're covered by a plan, 20 employees or more on the payroll. All right, so here are your options. Number 1 option is you absolutely do not have to do anything whatsoever. Meaning, we know about A and B, but again, large employer, 20 or more employees, you don't have to do anything with A, and you don't have to do anything with B whatsoever. All right, now, why would I even be suggesting this? Here's why. The reason why I would do nothing with A and B if I'm still working is because if you are contributing to a health savings account, these are tax programs that allow you to save money for future medical expenses, so they're tax incentivized. HSAs. Now, I want to clarify, this doesn't say FSAs, that's flexible spending. The rules that I'm ready to teach you do not apply to FSAs. They do not apply to HRAs, which are called health reimbursement arrangements. Only HSAs, okay, part of the tax code that allows you to set money aside right out of your paycheck. That money is then tax deductible. If it's a growth account, it grows tax deferred. And if you use it for medical expenses, it's totally tax exempt. So I love HSAs. And so here's the reason I would not do A or B. If you have an HSA, then don't take A or don't take B, because if you take A or B or both, both, you can no longer put new money into your HSA. The money that's in there is your money, but no new contributions. All right, and so I would do nothing if I have an HSA. Number two, now there is a myth that says that you have to do A only if you are still working. You still have to enroll into A, and that myth says this: if not, you'll be penalized for life. Okay? And people hear this all the time, and it is truly a myth. It's been a piece of misinformation that has been repeated many, many times, and so now people believe it's the truth, and it's not. All right? So the myth is you'll be penalized if you don't take, in other words, if you do what I'm saying over here, do nothing, people say you're going to be penalized. You'll even hear this occasionally out of the Social Security offices, okay? It is totally a myth. Here's the truth. Here's the truth. The only people that are ever penalized on Medicare Part A are those that have to actually buy Medicare Part A. Well, listen, folks, that is only 1% of the population have to buy Medicare A. It is true that if you have to buy A, you could be penalized if you don't start at 65 or at retirement. But if your Medicare A is a zero premium, meaning there's no cost for Medicare A, which is 99% of the population will have a zero premium. And the reason it's a zero premium is because you and I fund Medicare all of our working life. All of us are paying FICA taxes or self-employment taxes, right? And we're funding Medicare. So Medicare says this: as long as we have 40 quarters, which is 10 years worth of work, 10 years worth of work paid into the Medicare tax system through FICA deductions, then we will get Medicare Part A zero premium for the rest of our life. Okay? So you'll never be penalized because Medicare A penalties are percentages. For every year we go without, they charge you 10% and you pay the penalty twice the year. So if I go without 1 year on Part A, and I have a 10% penalty, and I'll pay that for 2 years. If I go without Part A for 2 years, I'll pay a 20% penalty, and I pay that for 4 years. Okay, but here's the point. And so it's a percentage that's added to those who have to buy Medicare A. Right now, anyone that has 0 to 29 quarters this year is paying $505 a month for their Part A. If I have 30 to 39 quarters, my Part A premium is $278, okay? So my point is those percentages are added to the 505, to the 278. But if I am over here at a zero premium and I have 1,000% penalty, what's 1,000% is zero? Zero. So that's what I'm saying. It's a myth if you have 40 quarters that you're going to pay a penalty. If you have 40 quarters or more, or your spouse does, you will never be penalized for Medicare Part A. Okay, so that is one option you have, and that is to do nothing. Hey, if you found this video helpful and you want to see more Medicare information just like it, then go below, right below the video, and you can give us a thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. Now, our second option is to actually enroll into A only. And up here, the only reason I'm not doing it is because I have an HSA. So otherwise, if you don't have an HSA, you're not contributing to one, and you don't see that in your future as far as at your employer giving you that option, then it is fine to enroll into A only. I would encourage you to do it. Okay? I'm not encouraging you to do it because you're going to be penalized, because we already know if it's zero, there's never a penalty, right? But the reason I would do this is because there may be a possibility that Medicare A would pay something. Now keep in mind, we're talking about groups of what? 20 or more employees. So if we're still working, covered by this kind of a group, what happens, the first payer is always going to be your company plan. Always. Second payer in this situation, a large group, is going to be Medicare. And again, we're talking about having Medicare A only. So what this means is that if I go to the hospital, because remember, that's what A is all about. B is outpatient, and A is hospitalization. So if I go to the hospital, what happens is there's a possibility that Medicare can pay something. That's why I'm telling you, enroll into it unless we have an HSA. Now, what happens is this. Medicare Part A will pay no deductibles for you. Medicare Part A will pay no co-payments for you. But what it will do, Medicare will pay co-insurance. So you may be on a plan at work where if you go to the hospital, the plan may pay 80%, you pay 20%. Medicare could pay some of that. Or you may be on a plan 90% by the company, 10% by you. And so again, Medicare, as they coordinate those benefits, they may pay some of your co-insurance. Again, there's no cost for 99% of all people to enroll into Part A, so I would encourage you, unless you have an HSA, take Medicare A only. They'll take the second payer position, and they may pay something that your plan does not pay. All right, and they'll coordinate those benefits, and that could work out to your benefit. Now, for those of you who decide to do exactly what I'm talking about here, nothing or A only, eventually you are going to want to go on Medicare. In other words, you're either going to stop working, or spouses, and you're no longer going to have that employer plan available for you. And so what I want to make sure you understand is that you can come into Medicare at a later date with no penalties and no problems. And so I want to explain the way this works. We call this the enrollment period, and this enrollment period is called an SEP. And that stands for a special election period. Now, everyone that starts Medicare at 65 is using what we call the IEP. And this IEP is for those starting at 65, but it only lasts 7 months. It is our birth month, 3 months before birth month, the month we turn 65, and then 3 months after. So if I'm starting at 65, I'm coming in during my initial enrollment period. But if I'm coming in later, why? Because I or my spouse or I continue to work, now we're going to come in using this special enrollment period. And so that's the enrollment period you'll be using. I'm going to talk about the process. So the process with this one is what we have to do is we have to verify that you have credible coverage from your employer, your spouse's employer. And so the process involved, there's actually 2 documents. One is called an L564. And this is something that if you work with us, we'd do this for you, but you actually would give this to your HR department. And HR is going to verify that through this L564 that you have been working or your spouse is working back to age 65. So this paperwork is not part of the initial enrollment period, but it always is a part of special enrollment, because this is what proves to the government that we're eligible to come in with an SEP, no penalties and no problems whatsoever. So the L564 has to be filled out. And then we have another form that we call the CMS 40B. And this is the form where we would tell Medicare when we want to start our Medicare benefits. So let's say my benefits are going to end July 31st. And you want to start Medicare August 1, you would put on the 40B form along with your name, address, and Social Security number. You'd put, please begin my Medicare August 1. All right? And so that's the purpose of that document. We get to pick the date we want to start. And by the way, I want you to know something from a practical standpoint. We never do this paperwork any sooner than 90 days. Okay? You're not going to do this paperwork 6 months in advance. You're going to do it within 90 days. So anywhere between 30 to 90 days prior to getting off the group plan is the perfect time to do this. The government does not want to see the paperwork any sooner than that. Okay? So that's the process. Now, what I want to point out here that's very important is the priority. Or we could say the key to all this is to make sure that if you don't start Medicare at 65 because you or your spouse are working and covered by a employer plan, 20 employees on the payroll or more, the key to this is to make sure that you never go without active employment and insurance that's part of a group plan. All right? And so we have to verify all the way back to 65. So had somebody in my career, that lady was 79 and the husband was 83. We had to verify all the way back to 65. For her, 14 years. For him, 18 years. Because we had to prove they had credible coverage. That someone was working and they were covered by a group plan back to 65. With no gaps at all. Not even 1 month gap. But as long as we have continuous coverage and active employment all the way back to 65, we qualify for an SEP and there will be no problems, no penalties whatsoever. Do the L564 to prove it, and then pick your date that you want to start your Medicare benefits. Hey, Medicare can be very confusing. In fact, people make mistakes all the time because of how confusing it is. So what I've done is I've actually created a Medicare, notice this, Essentials Workshop, where you have the opportunity to really learn everything that you need to know about Medicare so that you can make Medicare decisions. There are thousands of people every month that watch this workshop, and we get lots of reviews saying that this is something that really was helpful to them. And so what you can do is down here below in the comments section, you'll see where it says pinned comment. At the very top of those pinned comments is a link. And you click on that link, what we're going to do is we're going to give you free access to this Medicare Essentials Workshop. And we want you to watch it because we don't want you to make any mistakes. All right, so that brings us then to our third and final option that we have, and that is this, and that is to go ahead and do A and B. Now we know that you have the right to refuse A and B as long as you have a group plan where there's 20 employees on the payroll or more. You don't have to do anything. However, this could be an option for some of you, and that is to go ahead and go on Medicare. Now again, we've already said do nothing if you have an HSA, and do A only, as long as you don't have an HSA, it's fine to do that. We know Medicare is going to pay second. So let me tell you about this option here. Again, we're not required to, but you may want to. And so what I mean by that is that there's some people that they're still working, but they have a plan at work that is kind of mediocre. Okay, let's say it's mediocre or it's terrible, lousy plan. And so you're covered by a group plan, but it's lousy. Or we could say this way, it's expensive. Okay, so the price is not real good. And so what I would encourage you to do is this. All you need to do is to do a comparison. Compare your group plan option with your Medicare option. Take the time to do it. Now listen, if you want to work with us, you can call in and set an appointment up, and we're happy to look at the details of both of those options to make sure you're making the right decision. But take the time to make a comparison, especially mediocre, lousy plans that are very expensive. Now when I call expensive, I'm talking about a plan that is costing you about $250 or more a month for you. And you add your spouse and others, it may be more. But if it's more than that, then probably a little expensive, especially if it has a high deductible. All right, so how do we compare? What are we going to look at? Well, the first thing we're going to look at is what is the monthly premium that you are paying for on your group plan. What's it cost you to be on the plan? It's coming out of your paycheck, but you'll need to know that, the premium. Now, I want to note something here about this. Let's say that you're still working, but your spouse is on your plan, and that spouse is also Medicare eligible. Then I want to know two things about the premium. I want to know the employee-only price, and then I want to know the employee plus spouse price, okay? And I've had this happen many times. Employee-only price, premium's $100 a month. You add the spouse, and it jumps to $500 a month. So what's it costing to cover the spouse? Because sometimes we'll say, hey, that's a good premium. You stay on that, but your Medicare eligible spouse, since it's costing $400, we'll put them on Medicare. So find that out about the premium. That's number one, premium. Number two, what's the deductible? Is it $1,500 a year or $5,000 a year? And do you ever meet that deductible? Is that ever a factor for you? Because here, if I have someone that has a $3,000 deductible, that means you divide that by 12 months. That means it's costing them $250 every month just to meet the deductible, let alone the premium that they're paying. So what's our deductible? Do we ever meet it? Third thing, I want to know about your coinsurance. Are you on an 80-20 plan, a 90-10 plan? How does that work? And then I also want to know with your plan, what's the max out of pocket? If you got cancer and we're going through some very expensive treatments, radiation, chemotherapy, maybe surgery, and all that's involved with that, what would you have to spend? Sometimes these group plans, max out of pocket is maybe $10,000. It could be more or less, but find that out because that's an issue. And then we also want to find out about your prescriptions, right? Because Medicare prescription drug plans are continuing to get very, very attractive. So what's it cost you to get your scripts on the group plan? All right, so we're going to look at these variables here, and once we have those, then we can, as a company, we'll compare all that. We can tell you what your Medicare is going to cost you. If you go with a Plan G or Plan N, we have a very small deductible, $240. Your max out of pocket is going to be minimal other than paying the premium for the plan. And of course, we'll talk about how you can get your drugs covered by Medicare. So we'll just lay those side by side and see if it makes sense. Now, I want to give you just really a word of caution here. If you work with us and you ask us to help you with this, we're delighted to do it. But I will tell you this, sometimes even though people have mediocre plans that may be expensive, if you have a spouse on that plan that has no other options, so if you go on Medicare and they're going to lose the plan, we're probably going to tell you stay right where you are. Or if you have children, remember they're covered up to age 26. If they have no other insurance options, if you drop your work plan, that's going to affect them. So we would never encourage a person to go on Medicare if somebody else that's covered by their work plan is going to be impacted by that decision. But if no one's going to be impacted by it, and again, if Medicare makes more sense financially, then all you have to do is tell the company, I don't want the company plan anymore, and then go on Medicare. All right? And so I will tell you that the employer has to let you go at 65. You have a life-changing event. And so what you would be doing at 65 is you'd be enrolling into that initial enrollment period. Remember how long it lasts? 7 months. And the employer absolutely has to let you go on Medicare if you choose to do that. So the point is, this is another option, and that is do A and B if that makes more sense than your group plan. All right, so you can see some of you do nothing. You have an HSA. Others of you do A only. It's fine to do that. It pays in the second payer position. Others of you, you may want to do A and B if it makes financial sense.